Welcome to the recorded version of the Grantmakers and Aging web seminar, Powerful Tools for Elder Economic Wellbeing, Important New Resources for Funders, featuring Naomi Stanhaus, Program Consultant with the Retirement Research Foundation, Ramsey Alwin, Senior Director of Economic Security with the National Council on Aging, and John Feather, CEO of Grantmakers and Aging, from October 12, 2013. This event was made possible by a partnership between Grantmakers and Aging, the John A. Hartford Foundation, and the Retirement Research Foundation. Technical and production support is provided by the American Society on Aging.
Thanks, Steve, and welcome to everyone in our audience today. We are very excited that all of you have joined us for today's important webinar on powerful tools for elder economic well-being to learn about some important new resources for funders and for all of us who try to serve the needs of older people. Before I begin, I want to thank two of our members for their support in making today's webinar available to everyone. The John A. Hartford Foundation of New York provides continuing support for this webinar series, and today's webinar is co-sponsored by the Retirement Research Foundation of Chicago. We also want to thank our expert team at the American Society on Aging for providing technical and production support for the series. Before we begin, I want to ask a few questions to get to know our audience better. I know that we have a diverse audience today. We have funders and also service providers. So we want to get a little bit of sense of the kind of services that you may be providing or the kind of issues that you're involved with. So we're going to ask you a series of 5 yes or no questions. And the first one, does your organization provide funds to improve the economic security of elders? If you just answer yes or no. All right, Steve, what do we get? Okay. So most of you do not do that directly. If we could have the next one. Do you provide direct services, that is, for example, financial counseling, employment services, benefits, counseling or navigation, and so on? If you could answer yes or no to that. Okay, Steve? So it's close to 50-50 on that one. So if we move to the next question. Do you fund education in this issue? For example, financial literacy training. Mainly no to that one. And the next one. Do you fund public policy or advocacy, for example, around the use of realistic economic standards? Primarily no. And then our last question in our little poll to find out more about you. Do you promote economic security in ways other than funding? All right, great. About 70% of you do that. So with that, the issue today is that nearly 23 million older adults in the United States are economically insecure. They're either living in poverty or one bad break away from it, and lacking the resources to support their basic health, nutrition, housing, and daily needs. How can funders who are interested in improving the lives of America's seniors invest in economic security and their communities in manageable ways? What lessons can we learn regarding introducing new supportive tools and services to communities and bring these to scale? We are really pleased today to have two of our nation's experts to guide us through this discussion. Ramsey Alwin is Senior Director for Economic Security at the National Council on Aging, where she directs NCOA's Economic Security Initiative, a national multi-site demonstration to help struggling seniors tap community resources. She's also the leader of NCOA's Home Equity Initiative, which educates older homeowners on the wise use of their home's equity. During her career, she has worked with federal and local agencies, congressional staff, and national associations to promote an innovative economic security framework. Naomi Stanhaus is Program Consultant at the Retirement Research Foundation, where her work focuses on promoting economic security for older adults. This includes grants related to pension counseling, development of alternative personal savings vehicles, and advocacy to enhance economic security. She manages the Retirement Research Foundation's 3-year Economic Security Initiative in partnership with the National Council on Aging. So welcome to you both. If we go to the next slide then, Ramsey, let's start with you. What are the goals for today's presentation?
Thank you, John. It's an honor and a pleasure to be with you, and so many champions of economic security on the line. Thanks for joining. We are thrilled to have so many participants focusing on economic security. Today, we will learn about trends in older adult economic security, discuss a promising new approach to ensuring elder economic security, share free resources to assist in building the economic security of struggling older adults, and finally, discuss ways funders can get involved.
If we go to the next slide then, how does this project relate to the overall work of the National Council on Aging?
At the National Council on Aging, our mission is to improve the lives of millions of older adults, especially those who are vulnerable and disadvantaged. We've put forward a very ambitious goal that by 2020 we will improve the health and economic well-being of at least 10 million older adults by making comprehensive person-centered economic assistance and evidence-based self-management integral parts of programs, services, and policies for older adults.
As we go to the next slide, we hear a lot about the baby boomers and the huge growth of the older population in general, but we hear a lot less about those who are living in poverty. What do we know about this population?
Well, there's no doubt that the age wave has arrived. 10,000 boomers turning 65 every day. We hear a great deal about that. Yet, we have many vulnerable older adults living one crisis away with income below 250% of the federal poverty measure, or the FPL, which is about $28,000 a year for an individual or $38,000 a year for a couple. These are individuals one bad break, one health incident, job loss, loss of a spouse, the roof falling in, one incident away from plummeting into poverty. As the boomers continue to age, we know we'll have more and more individuals living on the edge. As of 2020, according to census data, we had 23 million individuals 60 plus with income below 250% of the federal poverty measure. It's experiencing two or more chronic health conditions. By the year 2020, that population of vulnerable older adults will grow to 28 million. And for those of you familiar with the updated supplemental poverty measure, which takes into account a more accurate sense of out-of-pocket health care costs, you know that these numbers can be even greater when we take that piece of the puzzle into consideration.
As we move on to the next slide, we've talked about this, but how does retiree income match retiree needs?
Good question. So we know how many vulnerable older adults there are living on limited income, fixed income, but we look to wider opportunities for women and the University of Massachusetts Boston's Gerontology Institute for a realistic measure of what it costs to make ends meet in the community. The two organizations have worked together to vet a widely accepted methodology that draws upon federal, state, and local data sets that are used by the IRS, the U.S. Department of Agriculture, the Centers for Medicare and Medicaid Services. These are data sets already out there in circulation that WOW and their partners at the Gerontology Institute have compiled to create a geographically sensitive measure of what it costs to make ends meet when you're 65 plus, depending on your household composition, health status, and housing type. On this slide, you'll see three snapshots of what the costs truly are. A U.S. average, a geographically based measure that looks at Alexandria City in Virginia, and Wichita County in Kansas. And you'll see the wide variation of the true cost of making ends meet. In Wichita, it takes about $21,000 a year for a single elder in a rental housing facility to make basic ends meet. Yet in Alexandria, Virginia, it's far more costly at a tune of about $30,000 a year. Across the nation, when we look at county by county the cost of making ends meet using this methodology, we see an average cost of about $23,000 a year just to make basic ends meet. No blockbuster, no gifts for the grandchildren, just a bare bones budget. So the first tool I share with you today is www.basiceconomicsecurity.org, a resource that will allow you to look up the true cost of making ends meet in your community.
That's a very important resource. Could I ask you to repeat that and also reiterate that this is a locally based resource that you can look up for your own community? So what was that web address again?
www.basiceconomicsecurity.org.
Great. Before we move on to the next slide, we've got another poll question for folks to test their knowledge of the issues we have. So, Steve, would you bring that up? A retiree needs about $23,000 a year to make basic ends meet. So the question is, what percentage of that amount does the average older woman's retirement income actually provide? So the answers are 94% of what's needed, 72%, 56, or 41. So if you would please make your choice. All right, Steve, if you could give us those results. Well, we didn't win the prize on this one. Ramsey, why don't you tell us what the correct answer is, and then we'll move on to the next slide.
Great, sure. Well, we do have some experts on the line, and we have some glass half full and some half empty, optimists and pessimists. The answer is 56%. The average Social Security income that a woman received in the most recent data collection is about $13,000 a year. When you compare that $13,000 a year to the WOW Elder Index, $23,000 a year, you come up at about 56% of what one needs to achieve basic economic security. And if you wouldn't mind sharing the next slide that illustrates that for us, John.
Okay. The next one after that. There we go.
We're right there, coming up short. So you'll see, as demonstrated in our poll, the typical income an individual relies upon or a couple relies upon in retirement, whether it be the average Social Security or the median income in retirement, and median income for our purposes today reflects a combination of private savings, pension or 401k, and Social Security, all of which come up short when it comes to achieving economic security as defined by the WOW Elder Index. This is a really important guiding piece of information for our planning and implementation of programs and grant-making strategies. It's important to know where we're going. The goal of economic security is critical. And once we have a goal of economic security, we then need to look at strategies to get us there. And we'll talk a bit later about very holistic, comprehensive approaches that will help us get our older adults to that standard of economic security. This visual is something that we often use to educate and inform our partner organizations in their planning efforts, but also seniors themselves, because they can clearly see they're coming up short and it's not their fault. It's virtually impossible to make basic ends meet living on some of these typical forms of retirement income.
Before we move on to the next question, I want to remind our audience that at the end of the presentation, we will have an opportunity for you to ask questions. We will need to ask you to do that in writing. On the right hand of your screen, you see a box that is marked questions. If you drop that down, you can start typing your questions in at this point. And when we get to the end of the formal presentation, we'll be moving to those. So as you think of questions, please start entering them there. So as we move to the next slide then, what are some of the other economic factors impacting older people?
Well, we know that the nature of the challenges older adults are facing are evolving, especially during the recession and post-recession. More complex financial issues are surfacing. Debt, foreclosure, bankruptcy, employment, and unemployment continues to be a challenge for us. So just a few highlights from some recent government-issued reports from the Government Accountability Office and the Federal Reserve. Consumers age 65 plus are carrying $10,000 or more in credit card debt. Often we say they're balancing the books on the plastic safety net. When basic ends aren't meeting, those credit cards are coming into place. For those who want and need to continue to work, they're finding it increasingly difficult to do so due to the economy, age discrimination, and our older adults are more likely to be unemployed for 99 weeks or longer, exhausting their unemployment benefits. Foreclosure rates are up, especially among those 75 plus, which is particularly disturbing. Filings have increased in terms of bankruptcy for our boomers and our older adults. People 65 plus are the fastest growing cohort in terms of bankruptcy.
Very sobering indeed. If we move to the next slide, let's talk about some of the new approaches that are coming out. So what are some of the new approaches that are being created to help in this process?
That's right. We want to talk about solutions. We have been testing at the National Council on Aging with many partners across the country new strategies to help our vulnerable older adults, given these new economic realities. These economic realities have stretched many of us in the field of aging to think differently about the way we do business. We have found that there are community programs available in the areas of traditional health services, housing, legal, finances, health and wellness, employment, etc. But often they're siloed or fragmented programs, not necessarily coordinating together. And from the perspective of a senior, it can be very overwhelming to navigate all of these resources. With the generous support of the Weinberg Foundation, the Bank of America Charitable Foundation, a partnership with credit unions, and many other local funders, back in 2009, NCOA launched something we call the Economic Security Initiative to take a very holistic or comprehensive look at what it means to navigate the maze of community, public, and private supports available. Many of the funders listening in are probably supportive of these important services found in communities, perhaps housing programs, health programs, legal programs, etc. The model that NCOA tested allows for us to leverage those investments further by beginning to break down the silos and coordinating across these different areas of specialization found in communities. We looked at creating strong, coordinated connections between the different service providers who impact a senior's economic security, bringing all these solutions around the circle to bear on an individual's circumstances in order to achieve economic security. The Economic Security Initiative focused on providing a comprehensive or person-centered assessment, an economic action plan, and then assistance navigating all the supports in the community that were required in order to get on track to economic security. We see this as a new service delivery approach.
As we go to the next slide, it's a very exciting initiative and an exciting idea. Tell us about what the results have been.
Sure. So we found in working with 20 community organizations, some experts in the area of aging, others experts in the financial services or the nonprofit financial services arena, that we could help over 6,000 seniors improve their economic well-being by about $300,000 a year. Now, when you think about the typical income for an older woman living on Social Security alone, for instance, that's a 25% increase in her budget. The solutions that we found to be most effective were always grounded in access to public benefits, prescription drug assistance, utility assistance, assistance with Medicare premiums and out-of-pockets. But access to benefits were not enough alone. Important combinations of services were required. Layering benefits plus money management and budget, plus debt and credit counseling, plus employment and job search assistance when appropriate. Bringing all of these services, bundling them together in a very comprehensive way, helped our older adults move the needle on their overall economic well-being. The learnings from this 2-year community-based demonstration have now informed NCOA's thoughts on how we can bring this work to scale across the country.
As we move to the next slide, you talk here about taking innovation to scale. Tell us what you mean by that.
That's right. Well, before I get into some of our scaling strategies, let me give you a very brief snapshot of what this approach has meant in the life of one individual, Mrs. Smith, a 79-year-old widow living alone in Cleveland with over $8,000 in credit card debt. She came to the table with the stress of the credit card debt, many unpaid bills, and was just paralyzed. With the help of a comprehensive assessment, an economic action plan, and one-on-one assistance navigating the many community resources that are available, we were able to get her comprehensive money management assessment, minimizing her expenses by about $124 a month. We negotiated lower interest rates on credit cards, saving thousands of dollars, utilized a debt plan to help her get debt-free in a reasonable time period, got her access to benefits, prescription drug, Medicare premium assistance, food stamps or SNAP, utility assistance, enrolled her in property tax assistance, additional money management and budgeting. All of this resulted in a decrease in expenses and an increase in her income and a minimization of the stress. We continue to help people like Mrs. Smith gain access to these vital services. However, in order to assist the growing numbers of older adults, we are thinking about scaling. We've taken Mrs. Smith's story and in partnership with 20 organizations across the country, we've developed a proof of concept around this economic assistance model with 6,000 seniors. Our goal now is to take those lessons and apply them through the use of technology tools to assist over 10 million seniors across the country. We know that key to scaling is creating technology tools that will help organizations better serve seniors and quickly connect them to community resources, and of course, to reach seniors and their caregivers directly.
Well, it's important to link, as you say, that local and national activity. As we go to the next slide, can you tell us how this model is being implemented locally?
Great. So the first tool I want to offer up in terms of getting this approach out to more community-based organizations is something folks can find on www.ncoa.org/ESI. With the generous support of the Retirement Research, the Bank of America Charitable Foundation, we have set out to create an online toolkit which will help build the capacity of organizations, both community and faith-based organizations interested in adopting the approach that we've discussed today. Create the necessary systems, policies, and procedures that allow the organization to embrace this holistic or comprehensive approach to economic assistance. The toolkit, which can be found online, includes 3 steps. The first is taking a readiness assessment. Readiness is defined as an organization's capacity and willingness to implement this approach. We have a very easy online survey that asks some basic questions about leadership and frontline staff engagement. If one's interested in adopting this approach, I encourage you to take the readiness assessment to see what you have in place or what you might consider putting in place in order to prepare to embrace the approach. After that step, we provide an implementation guide, a step-by-step set of instructions on how to set up a comprehensive economic assistance program that builds on your current capacity, your specialization in the aging field, but also helps build your capacity to meet the evolving and complex financial challenges our older adults are facing. Finally, we provide a clearinghouse of samples, templates, and tools organizations have used effectively in their case management strategy. This toolkit can help organizations wishing to embed the approach in their systems, and we offer it up free to grantmakers, faith-based, community-based organizations across the country in hopes of giving you the tools you need to adopt a local approach. We also encourage you to connect with NCOA staff directly for some one-on-one training and technical assistance if you're interested in implementing this approach.
That sounds great. Before we move to going through some of the parts of the program in a little bit more detail, I want to remind our audience, once again, if you go to the question box on the right of your screen, you will see it will drop down and it'll allow you to type your questions in. Go ahead and do that now if you would, and we'll be returning to that as we come to the end of the presentation. So let's actually dive into some more specifics. This is always a little bit complicated because, of course, this is a web-based program, and what we're showing people are static slides. So we ask our audience to bear with us a bit, but you'll be able to see it yourself when you go to the website. So as we move to the next one, we can start looking at this and talking about the way in which the program actually works. So why don't you lead us off on that?
Thanks, John. So the first tool I offered up to you as Grantmakers is a capacity building tool for the organizations you work with. Next, I offer you up an online tool that we see is really assisting in getting to scale. We know we must create turnkey tools. The implementation toolbox is a turnkey kit that organizations can use to embed the approach in their workflow. We encourage you as Grantmakers to share this tool with your partners for their use in planning and evaluation and implementation in programs. Now, if your organizations are already doing work of this nature and are just looking for a turnkey tool to help create some efficiency in terms of their workflow at the organization, we offer up a second tool, something we've called Economic CheckUp. Economic CheckUp builds on over 10 years of experience NCOA has had with the very successful BenefitsCheckUp.org. Both tools are free online and available to seniors, caregivers, and professionals. Economic CheckUp is a one-stop website for all things related to the economic security of an older adult. We took the lessons from the community-based demonstration to inform this online tool. Economic CheckUp identifies benefits that could save an individual money, find ways to cut their expenses, and develop a concrete plan to achieve greater economic security. Economic CheckUp is a decision support screening tool that provides help in regard to money management and budgeting, housing, health, employment and training, debt and credit management, consumer protections, and continues to screen for access to critical benefits that can help increase or supplement income. Now, this one-stop website can be found available on EconomicCheckUp.org. We've just soft-launched the program, and so I encourage you to just bear with us as you poke around. There may be bugs. We may not be immune to the technology bugs that all experience when rolling something new out. We certainly have heard about what that means for healthcare.gov in the past few weeks, and we're hopeful that we're in better shape. But as you visit EconomicCheckUp.org, please recognize that we're in an early rollout stage. We have tested a great deal with our economic security partners and our partners through the National Institute for Senior Centers in screening this tool, and we have gotten great consumer feedback. What we've made available is a platform that allows an individual to quickly go in, provide some basic anonymous information about their economic situation, and receive a customized report that shares better ways to utilize current resources and community programs and services that may help increase the economic well-being of the individual.
As we move to the next slide, how does this link to the resources that are available?
Sure. Well, we provide two paths for our consumer. Through EconomicCheckUp.org, one can conduct a full comprehensive assessment, and that will provide them then a customized report of all the community resources and tools we can make available to better utilizing existing resources. But we also know from our experience that sometimes individuals have immediate needs or discrete needs, and so we provide direct links off the home page to four important discrete tools. The first I share with you is JobSource. It's a comprehensive employment and training tool. It allows individuals to assess their skills and possible job matches, receive free online training, 32 online courses, and it also provides a customized job search engine for mature workers, looking specifically at mature worker-friendly opportunities.
Obviously, as you said in your previous discussion, reducing debt and cutting spending are essential as well. So if we go to the next slide, how does this help folks reduce their indebtedness?
Great. So again, right off that home page of Economic CheckUp, if an individual is coming to the table with debt challenges, we provide a direct link to our Reducing Debt calculator. This is an interactive, dynamic tool that individuals can quickly put in their information in regard to credit card payments and get some feedback on different ways to decrease the overall out-of-pocket spending and perhaps the interest rates and the timeline for payment. So again, if someone's coming to the table with a discrete need in regard to debt, they can get there right off the home page from the Reducing Debt calculator. And the same goes for the next slide, which looks specifically at cutting spending. This is also a calculator that individuals can use very quickly to help make a plan around budgeting and money management to better utilize their current resources.
Great. And if we move to the next slide, what kinds of questions does the system ask the individual?
Sure. Now, if an individual screening off Economic CheckUp on their own, or if an organization screening with a client wants a more comprehensive approach to see the full range of resources available for an individual, they would go through the comprehensive screening. This is a screenshot of the comprehensive, where we look at the basic income, employment status, debt status, housing status, health status of an individual. We go through a questionnaire that takes approximately 30 minutes to complete, and then provide a customized report, which is the next slide.
So go on to the next one.
This customized report is tailored to the individual's responses provided. It provides community resources as well as national resources related to money management and budgeting, housing, health, employment and training, debt and credit, and consumer protections. We have a database behind the Economic CheckUp tool that draws upon our very robust databases from the BenefitsCheckUp.org platform that provides customized information, local contacts where there are community resources, national contacts where there are national resources, and interactive calculators. So in this customized report, you'll see first there is a unfortunately, the screen is probably small for you, so I encourage you at your leisure in the coming weeks to take a look at the full-blown website. But you'll see a bar graph that provides your current status, and that is a bar graph which reflects the income that the individual has and how it compares to their expenses, as well as how it compares to what it takes to make ends meet in their community using the WOW Elder Index.
And then as we go on to the next slide, what kind of resources does this provide to older people?
Great. So the recommendations, as mentioned, are customized and include community resources as well as calculators. When we provide a community resource, we also provide a fact sheet, a detailed piece of information in regard to the program and how one might enroll. Right.
And as we come to sort of the end of the description of the program, our next slide, how does this effort build on the work that's already been done?
Thanks, John. So the Economic CheckUp tool builds on our lessons from the demonstration that I referenced earlier today. We learned a great deal from the community-level efforts and are extremely grateful to our partners in the field and the many local and national funders that contributed to that effort. Those learnings were then used to inform the technology development, which builds upon the very successful BenefitsCheckUp platform. For those who haven't visited BenefitsCheckUp.org, I encourage you to do so today. Since its inception, we've completed over 3.6 million screenings, identifying over $13 billion worth of benefits that seniors have been leaving on the table. We've helped individuals quickly find application forms for benefits programs, and in the case of the Medicare Part D low-income subsidy, we've actually forged a partnership with the Social Security Administration and the Centers for Medicare and Medicaid Services to help auto-enroll individuals into an important prescription drug assistance program. We're taking that powerful technology and now going beyond benefits and adding to it a very comprehensive look at the economic well-being of an individual, layering on top of the benefits credit and debt counseling, money management, home equity, just general utilization of existing assets, employment and training, and have come to bring you Economic CheckUp.
Well, that's really wonderful. Benefits CheckUp has been an amazingly successful program and has helped so many people around the country. As we go to the next slide, Naomi, let's bring you in at this point and talk a little bit about how grant makers can be involved, particularly local grant makers who may look at this issue as an enormous national policy issue and not see how they could be directly involved. So what advice would you give grant makers?
Well, first of all, even though Retirement Research Foundation is a national funder, rest assured we are also a regional and a local funder that tries to play nicely in our own backyard. And so while we currently have a major initiative in economic security in which we've invested in tools like in the research and development of tools like the Economic CheckUp, we didn't come to this initiative lightly or take the plunge immediately. We have waded in with many more modest and perhaps less risky funding strategies over the years. So we try to put down on this slide a number of ways that you as a funder could bite off a piece of economic security at your own comfort level, maybe perhaps starting with more modest investments of time and or money and less risk to maybe greater investments and what might be seen as greater risk, although investment level and risk are not certainly totally related. But the first is that, as a funder, you can be a source of knowledge to your community. We know that understanding the economics of aging and retirement security issues are complex and wonky. And so sometimes we stay away from them just because of that. But there are several resources that are out there. You certainly heard, you've certainly gotten a taste of National Council on Aging as a great resource with many user-friendly materials that you could use to become the source of knowledge and to share with your community. Some other examples are the resources that you can find from the Pension Rights Center, from the Center for Retirement Research out of Boston College, from the National Academy of Social Insurance, and then many, many Google groups like the Digest for Social Insurance. These will all give you a handle on the economic security issues and the tools that are out there to share. As leaders, funding leaders, you could certainly lead or facilitate community discussions among other funders and among providers, service providers and funders together. An example, about a year and a half ago, Retirement Research, along with Grantmakers in Aging and other regional Grantmakers associations, sponsored the Midwest Funders Forum on Economic Security. And that encouraged many funders who have broad bases of funding, who do not necessarily fund in the economic security arena, to come together to find an area of comfort within the issue. As we said, you can share many tools. Ramsey told you about the readiness assessment and the implementation toolkit and the economic checkup tools. I would really urge you, as soon as this webinar is over, to not walk but run to EconomicCheckUp.org because it's a really exciting tool to poke around even for yourself. And to help National Council on Aging bring that tool to scale by introducing it to your communities. We'd encourage you to invest in proven service models that can be brought to your local community. As an example, when the economic security casework model was being developed, we invested $25,000 in our local area agency on aging here in suburban Cook County to pilot test the model, and that leveraged a lot of other local funding. So that was a pretty modest investment in something that has had a really major payoff. We've also invested in, and this is something you can do in your local community, in the Pension Rights Center's work with the network of pension counseling centers. There are only 6 projects, but they cover 29 states. So your state may very well be covered by the work of these centers, which help consumers recover pension benefits and talk about leveraging your dollars. For a small amount of money, it's amazing that over a 20-year period, 35,000 consumers, mostly retirees, have recovered $125 million in pension benefits that would have been lost to them otherwise. So you really can get great satisfaction from a relatively modest investment on that part. And then finally, supporting public information and advocacy efforts. While it may be more difficult for you to find advocacy opportunities within the economic security arena because these look like large ones that are hard to find a fit with, a couple of the examples that we have invested in. We did invest in the wider opportunity for women's development of the Elder Economic Security Standard Index, and this is used by advocates across the country to press for changing eligibility so that more people would fall under the umbrella of benefits based on their a more realistic economic need. We've also made a modest investment in advocacy for the development of an automatic IRA program in which the state would administer a savings vehicle for primarily lower wage earners who currently don't have access to a personal savings device at their workplace. And this is going on in many, many states. Advocates are getting involved. And again, for a modest investment, you could help the advocates try to get something like this going in their state. So the bottom line is take a plunge at whatever level you're comfortable with, but do take the plunge.
Well, thanks. We're coming to the end of our presentation part of the program, and if we go to the next slide, you will see some very useful contact information and also the specifics of the websites that have been referenced here. At this point, we're going to move to your questions. Remember that you can enter those on the box on your right, or the right of your screen under the question column. And we already have some. The first one is actually not a question. It's just someone wrote in and said, fantastic. And I think that's probably a response that you get a lot of times when you present this, that it's really a very exciting response to a very complicated set of needs. So the first question, though, is how do you actually find the people that you are working with at this point or intend to? You talked a little bit about scaling from a single individual up to 10 million. How do you actually go about doing that? I think this is probably a question for Ramsey.
Great. Thanks, John. Well, we have a two-pronged approach at NCOA, as many organizations do. I think we have an approach to try to get to the consumer directly, to seniors, to caregivers, friends and family, to get to them directly. And so in the coming weeks, we will be moving forward from our current platform of Economic CheckUp to an even more robust platform and making a very concerted effort to push the tool out to consumers directly. And so we will be launching a major marketing and communication strategy, a campaign around ensuring everyone gets their economic checkup. They get their doctor's checkup. It's time for an economic checkup. In addition, we know to get to scale, we can't do it alone. We've got to have strong community-based organizations that we work in partnership. So we continue to work in partnership with the National Institute for Senior Centers, a very strong network of senior centers. We work with many of the area agencies on aging and aging and disability resource centers. And we will be working with those organizations, helping build capacity, providing these free resources to them, providing customized training and technical assistance, because we know so many of you at the local level, you too have a mission related to improving the economic well-being of older adults, and we just want to help you achieve that goal with the most efficient use of technology as possible.
Well, thanks. A question here is someone's asking about using this program in their local area, and just wanted you to reiterate a little bit that this is, as it's being launched now, this is a national program that is going to be available throughout the United States. And you have also referenced some specific local resources. Could you talk a little bit more about that?
Sure. For any organization interested in embracing this approach, I encourage them to visit ncoa.org/ESI to gain access to our implementation toolkit, the readiness survey, the guide to implementation, and the clearinghouse of tools. Any organization already doing work of this nature or poised to expand their capacity to do work of this nature can benefit from those resources as they customize their local programming. In addition, the Economic CheckUp tool is something intended for organizations to use with clients. What we found is in some of our testing, our organizations are able to use Economic CheckUp with volunteers or participants in the Department of Labor's Senior Employment Community Service Program, leveraging the volunteer CSEP participants to do the screening portion, freeing up professional staff to then really focus on some of the more sophisticated economic action planning.
Naomi, let's return to you with a question about the support from the foundation world. The question is a follow-up to the one that was just asked about are there resources at local levels, obviously other than in the suburban Chicago area, that would help local organizations implement this program? Any sense of how to access local funders to make sure that local funders are aware of the program and to get them engaged?
Well, at the funder level, I mean, hopefully many local funders are members of either their regional grantmaker association or a member of something like Grantmakers for Effective Organizations or other affinity groups that can come together to learn about these tools and then develop together strategies for educating their service provider networks and encouraging them to use the tools, either for no money or very small stimulus dollars that you could put in to encourage an organization to put the system into place in their existing work. I mean, I think Ramsey's big point is that these are systems that can be overlaid on the work you're already doing. But the other is in every community across this country, there is, by law, an area agency on aging. And if you, as a funder, would partner with your area agency on aging, which already has an existing network of providers that they contract with to deliver services, or in some areas deliver the services themselves, you will have a ready-made way to for a ripple effect to get these resources out.
Thanks. We have several people that ask if this will be available, this presentation will be available later after we've completed this webinar today, and the answer to that is yes. We will actually be doing this, putting it up on the Grantmakers and Aging website within about a week to 10 days. We do some editing of it and then provide it. It is, just like this webinar, is available to anyone who is interested, and it is free, and it remains on our website. And once again, our web address is giaing.org, so giaging.org. And you'll see there a list of webinars from the past as well. If anybody is interested in the slides from today's presentation, as Steve told you at the beginning, simply send an email to info@asaging, asaging.org. So another question that we had is, could you say a little bit more, I think this is one for Ramsey, about the demographics of poverty and aging, or those who are near poverty? Is it directly correlated to age, so that you can look at someone and say, if they're 65, they're less likely to be vulnerable to this issue, or if they're 90, they're much more, or is it much more varied than that?
Sure, good question. So we have taken a deep dive to look at the demographic trends related to the most vulnerable, and there's certainly some trends there you would expect. The older, 75 plus, more likely women, more likely women of color, more likely individuals living alone, geographically isolated individuals, individuals experiencing a housing hardship in respect to at least 30% of their income or more going toward housing expenses. So we have done some profiling of those that are more vulnerable. We've also done some geographic analysis to see where the concentrations of vulnerability may be. And NCOA has some research publications on its website. We also look to the National Academy of Social Insurance, the AARP Public Policy Institute has done some great work on the profile of vulnerable older adults as well.
Okay. Naomi, this one's for you. As we all know, many foundations are reluctant, I guess is the right word, to be involved in advocacy programs or public policy programs in general. Do you have advice about how you can effectively work in this arena, which does have obviously political as well as advocacy kind of implications, in a way that's effective for your foundations? What are some of the things that retirement researchers learned from this process?
Well, I think we've learned to understand pretty well the difference between public education and advocacy and lobbying. And, one of the mistakes that so many funders fall into is the fear that their dollars would be used for lobbying. And we work with our applicants to be very clear about where the line is between lobbying, advocacy, education, and we stay on the education advocacy side of that. There are lots of good pieces written about the differences. So, and I'm glad to share some of those if anybody would want to, contact me by phone or by the website. But we do a lot of work around public education because you can educate about the concept of something. For example, on a recent grant for support of an automatic IRA program here in Illinois, the grant is clearly to educate legislators about the concept, not a particular law, but the concept of a universal retirement savings account at the state level. So, I mean, there's lots of work that can be done in the area, and you just have to really be clear where your line is.
We have one more question, I think, and then we will move forward. And the question is, what is the rollout timeline of the program? You mentioned that this is just getting started, although it's building on work that you've been doing now for over a decade. So what is the rollout, and is it completely up and ready to go for individuals to use, or should folks be waiting a while and learning more about it, but then start enrolling later? What would be your advice to them?
Great. Well, organizations or grant makers interested in embedding the approach in their efforts, whether it be grant making or program service delivery, I encourage you to go to NCOA.org/ESI today and pull down the toolkit, the readiness survey, the implementation guide, and the clearinghouse of resources. For those looking for a tool to work directly with clients, I do encourage you to visit the Economic CheckUp tool. We have just soft launched the tool as of Friday, which means we are still monitoring for bugs. We have a beta version out there that has been well vetted by our community partners and consumers. But as we all know, with technology, you have to watch it closely because you never know when there might be another bug in the system. So if you do choose to look at the system, I encourage a few things: to take a look at the system through the internet provider of Chrome, that you want to use a Chrome browser to look at Economic CheckUp. And if you find anything as you poke through Economic CheckUp, to contact us. There's a feedback link right on every page that you'll visit. So if there's anything you find, we would like constructive feedback as we continue to refine this tool. Our hard push will start the second week in December. We have an outreach strategy focused on the public directly, seniors and caregivers, and a campaign message around that outreach. And so we will begin our steady drumbeat around the Economic CheckUp campaign directly to consumers in December and throughout 2014.
Really very exciting. So glad to see and get a little preview of this. We're about at the end of our hour, so I'm going to ask each of you to make your final comments to our audience. And Naomi, I'm going to start with you.
Well, I think my first message is don't be afraid to jump into what might seem like a complicated area, because there are many ways to get a handle on this. And, I'm glad to help any funder talk through ideas, because we've been there, done that, had to convince our board sometimes on some of these. So I guess that's my first message. My second is, if you are a funder, and maybe not a funder that does a lot in the arena of aging, and you have a lot of competitive populations that you're interested in, one of the myths is that older people are economically secure. And yet, we have a lot of data that makes a very compelling case that's very clear to understand. NCOA has a lot of that. We put a little of it, is to understand that this is really a very serious issue for most older people, especially older women. So, I'd say there's I want to dispel that myth and dispel the myth that it's difficult to do something in this area. And I'd lastly leave you with, do poke around at economiccheckup.org, because it's really quite an exciting, empowering tool.
Ramsey?
Great. Thanks so much. It's been a pleasure to be on the line with so many individuals interested and focused on economic security. I just want to give those kudos, those already working in the space, and echo Naomi's sentiment in inviting others to come on in. It's an important cause, economic security, economic justice for all. Really, it's an important cause for our older adults, and it requires all hands on deck. So we hope we've provided you at least 2 very free, very usable online technology tools that would facilitate your engagement in this very important cause. Get involved, stay involved, spend some time on some of the websites we've shared today. Share the tools, friends, family, community-based organizations, fellow grant makers, and don't hesitate to contact us if you want any one-on-one consultation in regard to how these tools might be useful in your efforts. We really look forward to working together to make an impact on the economic well-being of millions of vulnerable older adults together.
Thank you so much. I want to thank Ramsey Alwin, the Senior Director for Economic Security at the National Council on Aging, and Naomi Stanhaus, the Program Consultant at the Retirement Research Foundation, for their participation in today's program. We thank you for all that you do to make life better for America's older adults. I also want to thank the John A. Hartford Foundation and the Retirement Research Foundation for their support of this program, as well as the American Society on Aging for their technical expertise. Please join us next Wednesday, November the 6th at 2 p.m. Eastern, for an important discussion on why the Affordable Care Act matters to diverse older populations. Watch your email for registration information or go to the Grantmakers and Aging website, giaging.org, for more information. And finally, I want to thank all of you for participating in today's webinar. Have a great day.